Um, let's.
Okay.
So, hello everyone. I'm Dr. Sheela Nambiar. I'm an OBGYN and a lifestyle medicine physician. And this YouTube channel called Training for Life is basically meant to increase awareness about various aspects of health, including mental health, emotional health, etc., from a perspective of lifestyle medicine and allopathic medicine. And I invite various esteemed speakers to come and chat with me about different aspects of health, bringing in their experience to help educate and help us learn more about health and well-being to lead better lives, more longevity, prevent disease, manage and even reverse some of the diseases, and so on. So today I have Dr. Srinivasan. Dr. Venkat is an internist with over 20 years of clinical experience. He's a diplomat of the American Board of Lifestyle Medicine and underwent training at the renowned Benson Henry Institute for Mind-Body Medicine at Massachusetts General. He completed his fellowship at Andrew Weil Center for Integrative Medicine, and he's currently a visiting professor at the Department of Physiology in SRMC, Chennai. He practices in San Antonio, Texas. Dr. Srinivasan has written a textbook called Principles of Mind-Body Medicine, and his other books called Run, Leap, Sail, Dunk, and A Goalkeeper in Midfield reflects his passion for sports. That's really interesting, Venkat. Welcome, and thank you so much for being here, accepting my invitation. So let me just start by asking you first, why did you go into mind-body medicine?
Thank you for the introduction, Sheila. It's wonderful to talk to you. And it's very nice what you're doing because you're bringing in various aspects of health rather than just pills and procedures that get highlighted in either doctor's offices or in the media. So it's a very, very useful service. Why did I get into mind-body medicine? It was, I think, a natural progression. Intuitively, I've always felt that mental and physical processes are very, very closely related. The science behind it was not very well known to me. When I did my fellowship in integrative medicine at Andrew Weil Center, one of the first modules was on mind-body medicine. That's when I got introduced to the name. And then the more I started reading about it, I was fascinated to learn about the science behind it, on how the physiology of mental processes and physical phenomena are connected. And so that has led me here to pursue mind-body medicine.
And you went on to do lifestyle medicine as well?
Correct. I think that was the last missing piece of the puzzle. I was practicing as an internist. I'm both certified in internal medicine. So that is my fundamental framework through which I approach medicine. But lifestyle medicine was a very, very key component on how, diet, exercise, stress, all these things connect us to health and how they influence not only disease, but they can also offer us a better status of health. There's a subtle difference, as you are aware, because we always think about disease and absence of disease as health, but we all can pursue a better status of health, which is what training for life essentially is, I presume.
Yes. Better quality of life. Yes, certainly. So when I sent out the information about your talk, Venkat, I got a whole lot of questions on stress. So it's very clear that stress is a very popular topic and is also affects universally affects all of us in some way or the other. So can we start with what exactly is the definition of stress?
Okay. Stress, is fairly confused between the event that causes stress or the stressor, meaning, I got divorced, I lost my job, somebody yelled at me, I'm late for a meeting. These are what we call the stressor. The effect on us is typically what is interpreted as stress. In fact, when the scientist Hans Selye coined the word stress. He coined it as a general adaptive response. And then some of the physicists came and said, Dr. Selye, in physics, stress is what is applied on the system, and strain is what the system reflects. So it should not be stress, it should be strain. But by then, the horse had left the barn, and therefore, the word stress was there. And even in French, they had the word le stress. They didn't even translate it. They just used the word stress.
Mm-hmm. So it's been, yeah.
So stress should be understood as the response of us to perceived threat. That's kind of how I would broadly define it.
So it could be anything from losing a job to a minor stressor like traffic. It could be anything. Am I right? So what is this response, or what, as you said, strain? What is this physiological response that our body, how does it respond? How does the body respond?
Sure. I'll give you the typical example that I quote all the time. And so people who have listened to me speak are welcome to shut themselves off for the next 3 minutes, because this is a repetitive thing that I tell. See, if you have a deer facing a tiger, and the tiger is chasing it, now the deer has to run very fast. The heart has to pump, the muscles have to contract, the eyes have to be wide awake. There's no time for digestion. There's no time for reproductive processes. You want to shut all of those things off. You want to shed weight, so you empty the bladder and bowel, and you just run. The deer just runs. This is the acute stress response, or the fight or flight response, which determines whether this deer survives the next few minutes or dies. So this is nature's wonderful system, so that with just the flick of one switch, all these physiological events can happen that can help this deer survive. Now, within 15 minutes, the deer goes and starts grazing, comfortably. And it's not afraid, it's happy, it's eating, it's drinking water.
After it is escaped.
After it survives.
Yeah.
After the acute stress is gone. But what we are doing is, oh my God, am I going to see the tiger tomorrow? What's going to happen the day after? So we are ruminating. So what we are now doing is repeatedly triggering this stress response. And we are not shutting it off either. So we are in a state of what we call chronic stress. So if the heart is pumping rapidly, so what happens then is, you can get palpitations. And then, if it's pumping harder, high blood pressure. If energy is mobilized to run for the deer, constant energy mobilization increases glucose. So you're, higher at risk for diabetes. Reproductive processes get shut down. Infertility increases along with stress.
Yeah.
The deer, again, let's think of it. It's trying to protect itself against the bacteria in the mouth of the tiger. And it does not know what kind of bacteria come in. So the non-specific inflammatory response is primed to be activated. So when we stimulate the non-specific inflammatory response, aches and pains, skin conditions, psoriasis, arthritis, all these start getting activated. I know that was some of the questions that had come by. Can it cause skin problems? Of course it can. And the specific antibody-mediated response is suppressed at the expense of the non-specific response. So let me explain it a little bit further. The deer does not know what virus is sitting in the tiger's mouth. So it's not worried about getting, let's say, infectious mononucleosis from the tiger's mouth. So the antibody-mediated response is suppressed. Translate that into chronic stress. Antibody-mediated response is suppressed. So viral infections go up, vaccine response comes down. So, and the landmark study in New England Journal of Medicine, which came a few years ago, showed that common cold increases when people are stressed. They check students who are about to take their exams, and the
Yes.
incidence of common cold increase.
Increases.
So
Yeah.
now you can see the connection between acute stress, which is
Mm-hmm.
life-saving, and chronic stress, which has no known purpose. The body was not meant to activate this response repeatedly.
And not keep it there for so long, continuously, obviously.
Correct. That's the other thing. Yeah.
Yeah.
Yeah. Not keep it there so long. Yes.
Continuously, yeah. So just going back to your to the mind body medicine that you talked about, Venkat, I I want the viewers to understand why it's important that people like you, why is this mind body connect important in terms of health? How does the mind in, because earlier we looked at mind and body as two separate entities, and the connection was not so well, it was not acknowledged as much. So why is it that we do need to acknowledge it today, and why is it that we do?
Sure. When we went to medical school, they would call this as functional disorder and structural
Mhm.
disorder. Remember? So,
Yes.
meaning if anything was not anatomically proven, you cannot show it in a scan or an abnormal lab test. Oh, that's
Yes.
just a functional disorder. Don't worry about it.
Yes. Yes.
But patients don't care. If the body
Yes.
is getting affected, the body is getting affected, or the mind
Absolutely.
is getting affected, it's getting affected. So it is extremely important that if we flip the switch around and say, what is it that is bothering the patient?
Mm.
Every one of these does affect the patient.
Of course.
We all know, I had, I felt like throwing up when I saw that
Yeah.
scene, or I had butterflies in my stomach,
Stomach.
my
Yeah.
hands were cold. These are common expressions we have. So the mind-body connection has been known historically. This is nothing new. We all know that.
Mm-hmm.
But what mind-body medicine science is trying to do is, how do you leverage it?
Mm-hmm.
How can I use these principles to improve the health? Or
Mm-hmm.
to put it in simple terms, how can I think my way to a better health?
Mm-hmm. That's lovely. Yeah, that's a wonderful way of saying it. Yeah. Yeah. So if we had to say have a problem, a physical problem, like for instance diabetes, or any of the skin disorders as we had discussed, knowing that the mind is also involved in some way, and addressing that aspect of it, would it help with the healing process or even the trajectory of the disease?
I think it definitely would. And well, if we let's take the most easiest aspect of mind body medicine, which is sleep, which
Mm-hmm.
is where probably mind and body meet the most, or it is most evident where it meets. We
Mm-hmm.
know that an impaired sleep affects eating patterns, but also how glucose levels are controlled.
Mm-hmm.
And when you eat, and the excessive sleep can also affect your metabolism. Lack
Mm-hmm.
of sleep of course affects it. Stress affects sleep, which can affect glucose. So if
Mm-hmm.
you see, if I can just control this one aspect of sleep, and help improve that, I can easily make a big impact on their diabetic control.
Shift.
I'm
Yeah.
not going to say that that alone is going to work.
Yeah.
You still
Yeah.
have to do exercise, you still have to eat properly,
Yeah.
but without working on sleep, all those things are not going to be as effective.
Mm-hmm. Mm-hmm.
So yes, yeah, can it affect? Yes. And and then of course, how do you tackle stress?
Mm-hmm.
Meaning, even without knowing this entire physiology, if a person is completely stressed and he is worried about what is going to happen next, they are constantly thinking about, how do I increase my energy available? Meaning energy, meaning here we are talking about calories and glucose.
Mm-hmm.
How can I increase that to tackle this, rather than how can I bring my glucose down and go to a more calmer state? So more ice cream, more, sugary foods, they start going in.
Mm-hmm.
So without stress management, advising a patient until our face turns blue, is, you have to follow a diet, you have to follow a diet. We
Yeah,
know that it does not work
that's
until
what.
the
Yeah.
other aspect is also dealt with.
Yeah. So is it so? Yeah, that's taking from what you said. A lot of people do overeat when they are stressed out, and like you said, it's usually the high calorie foods, sweet or fat. But there are, and of course, that leads to weight gain. But there are people also who tend to not eat, lose their appetite, and
Mhm.
tend to lose weight. So, are these just different personality types? Are these people just responding to stress differently?
I think so. I think so. If you look at it, depending on which part of the body gets affected. Let me give you a simple metaphor
Yeah.
that'll make us understand. Let's assume that you have a faulty television in your room,
Uh-huh.
and anytime you have a problem with the power connection or anything that goes on, the first instrument that shows a problem in your house would be your television.
Mm-hmm.
It's not a, and at the same time, the next door neighbor may have a faulty air conditioner. And so when the power fluctuates, it's the air conditioner that would shut off.
Okay.
And the third house may have a water heater that has a problem. So it's not like you have a separate TV problem and air conditioning. So these are not three separate diseases. It's
Mm-hmm.
the electric problem that is manifested in the weakest instrument that you have. So
Mm-hmm.
if my weakest instrument is my stomach,
Mm-hmm.
yeah, I'm just telling it in a broad way. It's
Yeah.
not a medical term I'm using. So I'm going to use
Yeah.
the word weak, just, as a simple term.
Yeah.
So if I have a weak stomach, any kind of stress, that's where it's going to show up. If I'm
Mm-hmm.
a person with the potential for migraine, that's how it's going to show up. Every time I get a stress, I'm going to have migraine. A
Migraines.
third person may have arthritis that will flare up. So
Mm-hmm.
these are not separate diseases, but separate manifestations of the same disease
Yeah. So,
based on
like
your
you
propensity. Yeah.
Yes. So, like you said, and which is, I think, I mean, I've seen it over and over again in my practice as well. When you're trying to teach people to exercise regularly and eat healthy, it's like you said, it's just not enough to give them a menu and tell them that, these are the things that you need to eat or you need to exercise for X amount of time. One needs to also address what is going on to prevent them from doing what they're supposed to do, or even how do they reach the point of maybe being overweight. Let's say they're excessively overweight, how do they reach that point? Needs to be addressed as well, and stress could very well be a very, very important aspect of this. Would you agree, Venkat?
Absolutely. Absolutely. Because if you just look at it, in every movie in India, when the minute a person lights up a cigarette, you have a warning there that says, cigarette smoking can cause,
Nowadays, yes.
right?
Yes.
Now, it's not like somebody who goes to the movie theater suddenly thinks, oh my God, I didn't know cigarette smoking is harmful. You
Mm-hmm.
know,
Mm-hmm.
everybody knows it's
Knows
harmful.
it. Yes. Yes.
So, we doctors and also family members have created this thing of hitting people with more and more and more data saying, oh, this is harmful, or nagging to try to prevent the problem. So it's
Mm-hmm.
not like patients don't know. It's not like
Yes.
they think that eating, drinking, sodas is bad for health, or eating burgers and fries is not good. Everybody knows this.
Yes. Yes.
So, but why do they do this in spite of this? As you said, what led them there?
Yes.
Either you can unwind the whole process, which
Mm-hmm.
is a little bit complicated issue. It may not be possible right away to do that. The other thing is you don't fight the battle from that side. You go from
Mm-hmm.
another angle. For example, I had a patient who had who had diabetes, poorly controlled. She was in her 60s. And, I would talk to her about diet and exercise, but she would nod her head out of respect. But,
Mm-hmm.
nothing was happening. Then I tried to find out what's wrong. The problem was she had a daughter
Mm-hmm.
whose boyfriend had abused her grandchild. Okay,
Had a
sexually
new.
abused the grandchild.
Oh, wow.
And so now this grandmother is taking charge of this grandchild
Mm-hmm.
and is afraid every day that this ex-boyfriend can come by, daughter's ex-boyfriend can come by and harm the child.
Wow.
And the child comes home and she has no clue about any homework or anything, and she is just trying to wrap her head around how to manage a 6-year-old when she is in her 60s.
Mm-hmm.
Daughter has gone to work the whole day. Now,
Mm-hmm.
with this lady, if I go and talk to her about eating, 5 servings of vegetables and fruits every day and exercising, that's not going to work.
Yes.
I had to approach this in a way that makes sense for her.
Mm-hmm. Mm-hmm.
Her primary driving force is this protective instinct for her grandson. So now what I had to do was tell her, all I want you to do now is take your grandchild to the park every day.
Mm-hmm.
That was
Mm-hmm.
her treatment. There was nothing else as a treatment.
Mm-hmm.
So if she takes her grandchild to the park, she is going to walk with the grandchild, play with him, and that she is going to get her exercise. And then I
Mm-hmm.
told her, your genes are there in your grandchild.
Mm-hmm.
So feed your grandchild good quality food. So now she was not cooking for herself. So she was
Yes.
thinking, I need to cook tasty food for my grandchild. Now it became healthy food for my grandchild. Now I had to show my grandchild what to eat, and therefore, she had to make good food and eat. She had to become an example. This
Yes.
is how mind body medicine works at a
Mm-hmm.
patient level. It's
Yeah.
still the same diet and exercise, there's no difference, but the
Exactly.
motivating force is different.
Slightly different. Yeah. Yeah. So we need, what you're saying is that we need to understand the psychosocial aspect of every single patient before we actually address the patient as a whole, rather than just the symptom. And I'm sure this goes for not just diet and exercise, Venkat. It applies to every disease as well, isn't it?
Absolutely, absolutely.
Yeah.
Yeah, we think of, we are into this tremendous amount of, um, what to say, thought process where we think that there is one root cause
Mm-hmm.
or one effect. So this is the root cause. It's organ level, then cellular level, then enzyme level, then a molecular level. We
Mm-hmm.
think that there is one or a genetic level that is a problem, and you fix this gene, then that disease would go
Everything
away.
else
This is
is.
how we approach life. But medicine is not like that.
Mm-hmm.
There is what we call this is the biochemical concept of health, where one biochemical abnormality leads to the disease.
Mm-hmm.
But the biopsychosocial model of health, as was put out by George Engel, and then a
Mm-hmm.
lot of people took on that, is that multiple things affect. It's my preference, it's my faith, it's my friends, it's my
Yes.
family, it's my
Family,
socioeconomic status, uh,
job. Yes.
my mental status, how I perceive stress, everything changes, affects.
Yes.
But at the same time, when we look at it, a medical student may think, oh my God, this is way too much. How can I handle all these things?
Mm-hmm.
But I tell medical students this repeatedly. Don't think of it as overwhelming. Think of it as now you have 20 tools to work with. Pick the
Mm-hmm.
one tool. Okay, you cannot work on exercise, don't go there. Okay, let's work on sleep then. Let's
Mm-hmm.
work on something else. And then once you start that, and then gradually you build the other things around it.
Yes, 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 yes. I agree. I agree. So, what would you say, Venkat, are the most important reasons for stress today? because it's such a common word, and I think a lot of times it is almost an abused word.
Yes.
Everything stresses everybody out, so
Yeah.
it's lost its real meaning. So what would you say though are the top reasons for stress today?
You know, when I did a little bit of reading on burnout in India, statistics on burnout in India,
Hmm.
most of it seemed to be work related and
Okay.
not necessarily the hours at work or the money that they get at work or the job insecurity. A lot of it was my manager doesn't understand me, they don't
Hmm.
respect me. And this was
Hmm.
a survey from Times of India that had
Hmm.
come about 2 to 3 years ago. So a lot of it is work related stress off late.
So
Um,
feeling disempowered.
yes, feeling disempowered is a very powerful word. And I think that is so true.
Yeah.
Loss of control, as you
Awesome.
know, when we talk about the three axes of burnout and what are all the things that cause burnout, this loss of control is considered one of the primary reasons. So
Yeah. Yeah.
uh, burnout. But
Yeah.
then stress, so some are common. If a child's illness or a loved person passing away or losing a job, see, these
Yeah.
things are powerful stressor. There is no way you can go and tell someone don't feel stressed.
Yeah.
I mean, you are a human being. It's part of life that you get affected by these things.
Yes.
So, but fortunately, these are rare and are exceptions.
Mm-hmm. Mm-hmm.
Most of the time, if you look at it, we stress is in the way we perceive life,
Mm-hmm.
and so perception change is extremely important
Mm-hmm.
because it's if I see a tiger in every corner,
Mm-hmm.
I need to make sure that I can see properly that it's not a tiger, it's just a cat.
Yes.
But for
That
that, my
was my next
perception has
question to you. Yeah, that was my next question to you. Is it possible to change our perception of stress?
yes, of course. Yes, yes, and yes. Now, but having said that, we get a million messages on WhatsApp or other things every
Yes.
morning, right?
Yes.
Life is beautiful, look at, smell the roses. We all get these messages, but we are not able to retain and follow them consistently. And so there are a few things that need to be done. That while altering perception is very important, we need to also quieten down the animal brain that works out of fear,
Mm-hmm.
that is constantly working to overcome threat.
So you're
So
talking, when you say animal brain, you're talking about a part of our own brain.
correct. That's true. So yeah,
Yes.
thank you for clarifying. The lower, let's call it the lower part of the brain, which is the animal brain, and the higher part of the brain, which is the thinking brain or the man brain or
Yes.
human brain. Okay.
Yes.
So the animal brain is constantly, looking for, sources of, threat. So, and that needs to be calmed down so the thinking part of the brain can start working.
Mm-hmm.
So, in technical terms, you would say the amygdala needs to be quietened down and the prefrontal cortex has to start taking over.
Function.
So, so we need to establish practices that quieten the autonomic response.
Mm-hmm.
And so there is how, the relaxation response comes. There is we all are familiar with the flight and fight stress response.
Yes.
In the
Just
very same
explain
lab,
that. Yeah.
at at Harvard,
Mm-hmm.
where Walter Cannon, the great physiologist, discovered and described this flight and fight response. Decades later, Dr. Benson discovered the relaxation response.
It's
And I've had the fortune of meeting him, and I studied in his institute, the Benson Henry
Yes.
Institute for Mind Body Medicine. So we
Yes.
can discuss what the relaxation response is.
Yes.
So at some point, yeah, when
Yeah.
I'll let you lead. So then the third aspect. So the first is the perception aspect, then the autonomic aspect, which is quietening the autonomic responses so that we don't have the sweating, the palpitations, the stomach churning, and the stress hormones going all over the body. And the third aspect of stress is the stress related behavior, stress related eating, stress related, as you said, some people just curl up and lie down and they don't want to get up. And then the other group that is just kind of restless and anxious and nervous and
Right.
jumpy,
Yeah.
and then sleep. So we need to alter the behavior. So if you move the same behavior in the opposite direction, which is a voluntary control, behavior is under our control. So you choose actions that are stress
Yes.
quietening, sleeping properly, eating, choosing the right kind of food, exercising consistently, which is your passion,
Yes.
and and so you move from the behavior side,
Back
work
to
on autonomic response,
yes.
and then go to the perception.
Yes.
So when you work with all these three aspects, then you have a comprehensive stress management strategy. Unfortunately, in the lay press, they try to oversimplify. This morning on CNN.com, there was an article on how you can eat to make your stress better. And they had given like, eat fish and
10
chickpeas.
things. Yes. Yes. Yes.
But
Yes.
it's an aspect. But
Yes.
if you blow it beyond what it is supposed to be, if you
Yes.
don't think it's a strategy within the whole, where it fits in the whole comprehensive strategy, by itself, it has minimal benefit only.
Yes. 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 So just to reiterate what you just said, Venkat, it's the perception, the physiology, and therefore the behavior. So we need to break. Is that right?
Correct.
So
Perception, the autonomic physiology, and the behavior.
and the
Perfect.
behavior.
Yes.
Yeah.
Yes.
And I loved what you said that the behavior can be, if that is addressed, and in small ways, it can be just something really small, like you said, sending your patient to the park with her daughter, something small like that. It can go back and start to change other aspects of your stress
Correct.
response,
Yes.
right? So rather than trying to address the perception right away. Is
Yes.
that what I'm hearing? Yeah.
Absolutely
Okay.
true. So
Oh.
the role of the clinician is to find out which is the lowest hanging fruit, and then work on that first, and then go with the patient's belief system. And
Yes.
if you have someone whose faith is the biggest force for them, then work
Yes.
with faith.
Yes.
And don't
Yeah.
undermine that. But yes, I think as we need to go from I'm paraphrasing a great physiologist or a physician who wrote, we need to go from working on what is broken to strengthening what is already great.
Yes. 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 That's an amazing. Yeah. No. Now, how? What would you? I asked you about stress. How can we change the perception? You addressed that. And you also addressed, in fact, that was my next question about if we can address it from the behavioral aspect rather than from the, in psychology, you're taught that your belief systems trigger the thoughts, and the thoughts in turn trigger the behavior. So instead of trying to address the belief system first, going from the behavioral aspect can really, it's an easier thing to do, as you said, the low hanging fruit. So what, talking about nutrition and talking about, like the diet that you spoke about, what is the role of nutrition in stress? I mean, aside from the fact that some people who are stressed tend to overeat or eat the wrong things, how does eating the right things, does it help?
It does. It does. In fact, that was the crux of the article, as I said, I came across this morning, just a couple of hours ago. So generally avoiding sugary foods
Yes.
would help. And the simplified way of understanding is that you eat sugar, then after a short while, body secretes a lot of insulin, and then sugar crashes, and that creates an autonomic response. So your
Craving,
adrenaline
yeah.
goes up, and therefore your whatever, if you're already stressed, it's going to make it even worse. Um, Whereas eating green leafy vegetables, fruits, the boring stuff over and over again that we
Yes.
say, so
Yes.
that works. And that generally kind of tends to calm down. We also tell patients to avoid hunger.
Mm-hmm.
Okay. So don't, let your body know that if 9 o'clock is your breakfast time, don't punish it. At 9 o'clock is your breakfast time, give it
Mm-hmm.
breakfast. And the same way, minimize caffeine.
Mm-hmm.
Remembering that, I'm sure most people know that most sodas contain caffeine. Now,
Yeah.
a monster drink energy drinks are huge sources of
Yes.
caffeine
Yes.
for young students.
Yes.
So minimizing that would help a lot.
Mm-hmm.
So I would say, green leafy vegetables, eating a spectrum
Fruit.
of vegetables of multiple
Yes.
colors, eating a
Yes.
lot of fruits would
Yes.
help, and
Yes.
avoiding sugary sweet stuff.
Yes. So a whole food, plant-based, plant-centric diet would
Yes,
as we say in lifestyle medicine. Yeah.
yes,
So
absolutely.
so you spoke about sleep, Venkat. You did touch upon sleep. Um, but the question I'd like to ask is, how does stress, being stressed out, how does that impair our sleep? How does it physiologically? How does it impair our sleep, both quality as well as quantity?
Certainly. Well, let's go back to that deer. The deer has to be awake when the tiger is chasing, right? So the alertness, being alert, is an extremely important component of the stress
Correct.
response.
Yeah.
So if we keep activating it, the alert, so we remain alert
Being awake.
for a
Yeah.
much longer period.
Yeah.
So at least an hour or two before bedtime, we need to start, finding a quiet place. So,
Mhm.
if you look at a bear that is sleeping, the cave is a safe, quiet, and a dark place. So, which means our bedroom needs to be, and it also has to be a little bit cool.
Mhm.
So our bedrooms need to be a safe place for us, which means we should not be watching TV in the bedroom. We should
Mhm.
not bring our work into the bedroom. Our work computers should be off. And anything that triggers us emotionally.
Mhm.
So especially watching political news or any such thing, that should be off, because that evokes a lot of passion, and keep them off. So the bedroom tends to be our refuge. That needs to be our cave. I need to go there and feel safe inside. So I'm automatically cutting off the triggers for the stress response.
Mhm. Mhm.
So I think that is one aspect of good sleep hygiene.
Yeah. And on top of this, like you said, that human beings have this unique ability to ruminate. So if you haven't fallen to asleep, your mind is going on and on about the things that have happened through the day or even projecting into the future.
Yeah.
So I'm sure your relaxation response and, conscious breathing, meditation, all these things would help.
Definitely. And even more simpler than that, a very easy way to work on rumination that I tell all my patients is to start a journal.
Mhm.
So you take a journal. A journal is not a diary. A diary, you record events that happen. Journal, you reflect how you felt. It's your impression of the day-to-day events that happen. So have a journal and write down in it and then close it. It's not necessary that we have to read the journal. But what we have done now is take this rumination and parked it somewhere else. And for some, that conscious act helps. And for a lot of people, it helps. So starting a journal would be great. For people of faith, prayer would be great.
Great.
If faith is not a big part,
Mhm.
surrender to nature. Acceptance is a huge thing.
Mhm.
Some days when I feel very stressed, I kind of go to bed, voluntarily telling myself, I have done whatever I could this today. If you
Yes.
wake me up, I will come back and fight tomorrow. If you don't wake me up, it's your problem. And then I go to bed. So, it might sound silly, but, that thought kind of calms me down, saying, I'm not responsible for this work. It
Yes.
was there for billions of years before I came. It will
Yeah.
be there for billions of years. And
You
so
can only
accept.
do what you can do. Yes.
Correct. So acceptance, finally, that's a very important thing.
Yes.
Um, so music may help
Mm-hmm.
uh, a lot of people.
Mm-hmm.
So yeah,
How does help exercise help, Venkat? The exercise, the response.
exercise, in multiple ways. One is exercise is a much, the way I explain to patients is this. I advise exercise more than meditation in most people who are very stressed out.
Mm-hmm.
The reason is this: if your body is already wired up and you are so anxious and nervous, you are what we call hyper vigilant.
Mm-hmm.
If I tell that person to sit down and meditate, it's not going to happen because
Yes.
there is a disconnect between the 1,000 miles per hour mind and the body sitting down. It's going to push them. So what I tell them is you start exercising in a conscious way, meaning anything that involves your attention, not mindless running, but something that is mindful. For some kids it might be boxing, for some people it might be dancing, which
Mm-hmm.
involves a certain amount of attention. So you're moving your body now and dragging your mind along with that. Now once your mind is now moving to the sway of the body, and then when your body kind of calms down at the end of it, and then you quieten it, and then you sit down, now your mind is willing to listen because it has walked along with the body.
Mm.
So here I use the body to work on the mind.
That's
So
wonderful.
I
Yeah.
think dance is a phenomenal form of stress buster. It
Yes.
also has the third component of emotion that you can evoke,
Mm-hmm.
which other forms of exercise cannot. For young, very super active kids, combat is very good.
Martial arts
Eh,
and
yeah, like karate or boxing or something.
yeah.
Uh, Swimming is another great thing. And
Mm.
then if you can calm down and focus, then jogging and even walking, where you're consciously walking, mindfully walking,
Okay. Yeah.
all of that helps.
Yeah. Some of the questions that came, I'll address some of the questions that came up, Venkat. Um, can you identify stress from depression? And can prolonged stress lead to depression?
In medicine, the minute a question starts with the word can,
Mm-hmm.
the answer is yes. Okay, because we never say never. So if you say can this cause this, yes,
It
it
can.
can.
Yeah.
So can stress or recurrent stress lead to clinical depression? Definitely.
Mm.
It can. Depression is a clinical word with clinical implications, meaning it's made based on certain criteria.
Mm.
If you have those things, and then there is a treatment plan. So I tend to avoid the word depression and anxiety because they get thrown out very, very easily.
Easily, yes. Just like
So
stress. Just like
yeah,
stress. Yeah.
just like stress. So I just ask people, are you comfortable or are you not comfortable?
Mm.
When I ask my patients, I just ask them, hey, are you emotionally comfortable? I just ask them an open-ended question,
Mm.
and then I let them take it off from there.
Mm.
So yes, yeah, in a short form, can this cause stress cause depression? Yes.
It certainly can, yes.
And it can also cause anxiety. It can cause post-traumatic stress in some people.
Yes.
Uh,
Yes. And the other question was, can stress lead to autoimmune diseases like thyroid disorders or even psoriasis and arthritis?
See, there are two components,
Yes.
right? One is what predisposes us to autoimmunity. Autoimmune meaning I'm making antibodies against myself.
Myself,
I
yes.
think that is most of it is genetic predisposition. Either you're predisposed to develop antibodies or you're not predisposed to develop antibodies.
Yes.
Either, I think that's kind of how I understand it. I'm not a great immunologist, so I'll stand corrected if somebody corrects me.
Yes.
But the propensity to make it better or worse, let's say very simple. We know medicines can make these antibodies less prominent.
Mm.
Like, meaning you can give steroids and then it comes down, and
Yes.
there are certain other. I mean, you take medicines to make them better or worse. So
Yes.
that you can alter the power of or the severity of these diseases. So we also learned that stress causes a flaring up of the inflammatory response, the
Mhm.
non-specific inflammatory response. So when we dampen that stress response, we tone it down, the effect of the antibodies in creating damage to the body, causing more joint pain, more skin problems, more worsening of our, whatever diseases we have, is true. It
Yes.
will make it better.
Make it
To
better.
what extent? To the extent that there is a reversible component which is stress related in that person, to that extent it will help. So as part of a treatment plan, an additional thing would be to work on stress also.
Yes, yes. But we also, like, for instance, in skin problems, Venkat, we do need to look, again, like you said, it cannot be just one thing that causes the problem. We do need to look at the food. For instance, they may be reacting to something that they are eating. You do need to look at the environment. They may be reacting to something like even their floor cleaner, for instance, or the
Yes.
soap that they're using, etc. So I think it's not one reason, like you said before. Stress is not the only reason, but it certainly can trigger trigger the reactivation of any one of these diseases, or activation or reactivation of any one of these, isn't it?
Correct. Yeah, I'll emphasize. You said activation and
And
reactivation. So both. Yeah. So I
yes,
wanted to highlight what you said.
yes,
Correct.
yes,
Yeah. And just as a side, I know you and I probably have seen quite a few patients where milk is triggering a lot of
yes,
inflammation.
yes, yes. And once they stop the milk, it's amazing the risk. I had a patient, pregnant woman who came to me, and she normally, the concept is that they need to drink a lot of milk because they need the calcium. But and she had severe psoriasis. So right through her pregnancy, she was continuing to have the milk and the milk products, and I didn't want to push regarding, don't stop the milk, because then the whole thing of, how is the baby going to be? Pregnant women need milk. Although I did mention it to her that you can go off milk, and even during pregnancy, post pregnancy, post delivery, she went off milk and milk products completely, and it is just remarkable, the improvement in her skin. In fact, she took photographs and sent it to me, and now she's completely lactose free. Lactose, like you said, has a very has an impact, as do many other things that we consume, isn't it?
Yeah.
So we do need to look at all those things. It's not
We do
only.
need to. So
Yes,
correct. So we need to look at all
yes,
the components, and
yes.
diet, of course, is a very, very important
Right,
component.
yes. And even sedentary living, for instance, Venkat, we're talking about exercise, but people who exercise sometimes believe that just that 1 hour of exercise is sufficient, and that they can be sitting, rest of the day. But it has been shown that just sedentary living by itself and sitting for long periods of time can cause a whole host of diseases, isn't it? Including mental problems like depression and stress and things like that.
Absolutely.
Yeah,
The
yeah.
relationship of exercise to depression is much more robust
Mhm.
than exercise with anxiety.
Mm. Mm.
Exercise as a treatment modality for anxiety, it's not really proven to be like as effective treatment problem. Because if you think of it, anxiety, there is a lot of perception problem. I'm perceiving threat everywhere. So
Mm.
unless I work on the threat perception, anxiety is not really going to change much.
Change.
So
Yeah.
there, the autonomous response and the perception needs to be addressed more effectively.
Mm.
In depression, whereas behavior makes a big difference, in mild to moderate depression, exercise is as effective as any medication.
Antidepressant.
Yes,
Yes.
as an antidepressant. So therefore, in any patient with depression, the first treatment should always be exercise. Meaning not somebody who's suicidal. There
Mm.
I can understand.
Yeah. Yeah.
It's a different component.
Yeah.
But in others, most physicians and most patients should remember that exercise is very, very important. So
Important.
dragging ourselves off the couch to do something. And
Physical.
as you said,
Yes.
not only physical exercise, the non-exercise
Yes.
physical
Yes.
activity,
Yes. Yes.
NEPA, as we call it.
Yes. Yes.
Just to highlight it again, it's technically called NEPA or NEPA, non-exercise physical activity.
Mm.
And that is also very, very important.
Important. Yeah. There was one question: does biting teeth, I think they mean grinding teeth, during deep sleep relate to stress?
Uh, it's, bruxism, right? Yeah.
Yes.
It, I'm not so sure if stress is causing that or not.
Mm. Mm.
It would be worthwhile definitely to look into that patient's and ask them about their stress history.
Yeah.
And if so, yeah, definitely it's worth
Yes.
exploring.
Yes.
I
Yes.
cannot say with certainty I've read any study that says they are definitely connected.
Yes.
But
Yes.
again, as before, can always is yes, right?
Yes. 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 Um, how do we recognize stress in ourselves? That's a wonderful question.
I think that's
Yeah.
the most, it's terrific thing. We need to first sit down and make an inventory. The SMART program where which I attended, stress management and resilience training program. One of the components is stress recognition. So
Mm.
the first or second week, we teach patients how to recognize their stress signals.
Mm.
So we ask patients to first make a list of what all are the symptoms. So some patients would write headache, some would say sweating in my palms, another one would say pain in the back of my neck. Others would feel their face twitching, face
Mhm.
getting flushed, um, an urge to go to the bathroom,
Mhm.
um, shaking of hands,
Mm.
tremors, all these things.
Sorry, sorry, sorry.
So, no worries. Yeah. So, all these are each person's individual stress symptoms. So, the first thing is to make an inventory. Sit down and write down, these are my stress symptoms. And then the next time it happens, recognize, okay, this is what is happening to me. You
Yes,
naming it, identifying it as half the battle won.
yes.
Then we can start working on it later.
Yeah. So now the smart program that you were telling, you were just mentioning, Venkat, do you run it as a regular program? And is it available for everybody? Is it online?
Yes. Thanks for asking. Yeah, I run it online on Zoom platform. So, on my website, you can enroll for
I'll
the
add the
program.
link. Yes,
Yeah.
the link is there in your but we will add it again in the comments in YouTube. Yes.
And
Yes.
I'm planning to start my next batch in March.
Okay.
So either I run the full SMART program or a modified version of it as a mind body wellness program to
And
kind of. Huh?
how long is it?
This is typically a smart is 8 weeks because it takes that amount of time to alter
Absolutely.
behavior.
Yeah.
So
Yeah.
it's once a week on Zoom for about 2 hours.
Okay. Okay. That would be
Uh,
good to know. I will add the link to your website so they can contact you through the website and
but
register for the program through the website. Am I right?
yes, yes, Sheila,
Okay.
yes, take care.
Okay.
Yeah.
Okay. So the other question: are stress and anger related? Because when extremely stressed, most of us tend to lose our temper for the smallest things. How do we manage our anger when stressed?
Well, the first thing is to recognize, as you said, in this person, anger seems to be the first response that comes.
Mm.
So the first thing is when anger is happening, okay, this is my stress
Stress.
signal.
Yes.
Okay, the first thing is don't act. on the anger, meaning that's because you can have repercussions that can cause even more problem. Yelling at the boss, or breaking something in the house, or
Yes.
So first thing is recognize it's my stress thing. At least walk away for a while. At least don't act on it, because, to prevent the immediate danger.
Yes.
The next thing is then try to find out what is it that is causing the anger. Then we go to the root cause analysis method, where I became angry because my son did not do his homework.
Yes.
When I get angry that my son did not do his homework because I feel that my son's future would be lost. I feel that my son's future would be lost, and that affects me because I love my son. So the underlying principle is I love my son.
Yes.
So let me now go to, if I love my son, what can I do to make sure that he does the homework? So now you are going from the other side, from the positive side, you're approaching the same problem. So that's one way where the perception has to change. But, asking someone, when you are angry, count to 10 or take a deep breath, at that point, the stress hormones are just going out.
Yes.
Counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, punch. That's what we're going to do. So might as well step away.
Yeah. Walk away physically.
Father had a simple rule: never write a letter when you are in anger.
Yes.
And and that's nowadays, don't tweet
and don't send a message. Now it's even easier.
Correct,
don't send a message when you're.
Put the phone away. Don't tweet or text at the time.
Yes. How do you? The word stress is used often these days. Anyone with autoimmune disease will get stressed. How does one identify stress? So that you answered. How do you deal with people who know your weakness and provoke you? That's cute.
Well, as I said, always knowing is the problem. Knowing is the victory. So if this person already knows that somebody is provoking. See, I'm vaguely entering into the field of psychology, which I'm not a psychology expert. So, some of it is based on common sense, and some of it is going to be based on what my patients have told me. So understand that if it doesn't look very scientific, my limitation. Okay, bear with me. So how do you act if someone
provokes you? She said.
Provokes me. I would ask that person, how would you like to approach it? Instead of me giving an advice, I would ask that person, what do you think is the most correct way of doing it? How do you, and then you come up with your treatment plan. And what prevents you from following that is the animal brain working, the fear and anger. So calm that down. You have the solution in the top brain. So allow that to come through, and you will find the solution. So don't expect the doctors to drive the bus. You have answers, but just calm the rest of your mind, and then you will get your own answers.
Yes, that's a very powerful statement. You have the answers, and we're just helping you actually realize those answers, isn't it?
Correct. Yeah.
So, and one last question. I think we've been talking for an hour, more than an hour. How do you deal with people who throw their weight around to get attention, and how to avoid stress in such a situation?
We've never met that kind of a person, right? Well, Sheela is the head of an organization, so you have to handle this more calmly than I do. How would you handle it, Sheela? Why don't you answer that question?
For instance, somebody who's throwing their weight around, I would look at it this way: that is not about me, that's about that person, right? So and I wouldn't take it personally, because I think it's a reflection of that person. So my getting stressed about it is not going to help matters, because that's not going to change that person's behavior. So I think the simple rule to follow is just, the Alcoholics Anonymous and the Serenity Prayer, which says, understand what you can change, have the courage to change what you can, and I think I'm mixing that,
And the
and the
wisdom to
wisdom
know
to
the
know
difference.
and the wisdom to know the difference. So in a situation like this where there's nothing you can do, there's just no point stressing about it. That's the philosophical way of looking at it. Sometimes I think that's really the only way of looking at something like this, right? Because what can you do about something like that?
You know, I cannot even change the behavior of my dog. Okay. So expecting me to change the behavior of that person because that person believes that that behavior is beneficial for them. So, they are not going to change because they think that is a very useful behavior. So the
Yes,
main
yes,
thing is, as my teacher, Swami Chinmayananji used to say is don't give the keys to your happiness in someone's pocket,
the same
so,
thing. Yes,
yeah, so, don't allow that to happen. And so, associate yourself with good people, you know,
yes,
that,
yes.
that's
Social.
a choice, you know, if we are with a good set of people, then we don't have to worry about it. And we
Yes,
can tell that person then, hey, cut it out, you're throwing your weight. Because
yes.
if you have a friend and that person will thank you for saying that.
Thing, yeah. Well,
So,
perhaps this person who asked the question is in a situation where she can't. I mean, it's not a choice. Maybe it is
correct.
somebody
Yeah.
who she. So it is difficult. But in situations like that, there's really nothing much you can do, as you said, isn't it? You can't change the behavior of another person. So acceptance, like you said,
Mhm. Correct.
acceptance would probably be, a good way to go.
Yeah, acceptance is one way, and then that's why we come to the relaxation response.
Hmm.
Why I talk about relaxation response here is, with the relaxation response uh, is the meditation based practices that can elicit a tremendous amount of so to call good effects, the anti-stress effects in the brain and the
Hmm.
body. When we do that, we are now filled with a certain amount of peace,
Calmness.
calmness or peace or joy or whatever, something on the positive side. Now I'm not worried too much that somebody is doing something else because I'm already full here.
Yeah, yeah,
So
yeah.
we need to discover that aspect within ourselves.
So, what is it that? So do you have protocols that will increase this relaxation response or help one to incorporate this relaxation response as and
Yes,
when needed?
yes, there are. If you let me, do you think we have a few minutes?
Yes, of course, of
Okay.
course. Yes,
See, the way relaxation response was discovered, we need to kind of know how this came about. So this is not like Dr. Benson pulled it from thin air. So
yes.
when Dr. Benson was a young cardiologist at Harvard, he was doing research on monkeys. And so he wanted to prove that monkeys can control their blood pressure. So he would shine a white light uh, if the blood pressure was high and a blue light if the blood pressure was low. And then after he shone the blue light, he would give the monkey a cookie to eat. So the monkey started associating blue light means cookie. So the monkey started lowering their blood pressure. So he said, "Oh, see, monkeys can control their blood pressure. It's not an autonomous response alone.
Mm.
Autonomic response alone, I can even make it volitional, under control."
Yeah.
A group of people who meditated at that time, there was a group that did transcendental meditation, that they came and
Mhm.
said, "Dr. Benson, why don't you do a research on us?"
Mm.
So he did a research on them where he put he checked their oxygen level, he put a mask on their face, an artery catheter, even a rectal thermometer, and then told them to meditate for 20 minutes.
Wow.
So you have to keep your eyes closed and think whatever you want. And after 20 minutes, he'll ring a bell. And then they have to meditate. And after another 20 minutes, he'll ring another bell. And then they have to wake up and then close their eyes. So the
Mm.
control and then the relaxation and then control.
Mm.
What he found was within a few minutes after they started meditating, during the second phase, which is first phase is thinking, second
Mm.
phase is meditation, their heart rate slowed down, their
Mm.
breathing pattern slowed down, their amount of lactic acid in the blood, which is a reflection of cellular metabolism, that also started coming down. The temperature did not change. And the brain waves also started, becoming slow and deep, as though in deep sleep. No, so many of them, we called it a wakeful hypometabolic state, low metabolism but awake. Because what he could see in deep sleep, after 3 or 4 hours of deep sleep, he was seeing within a few minutes, they were able to elicit that. And he called it the relaxation response. And he found that he could elicit the same thing with yoga, with the Tai Chi, with so many other practices. Another practice is called progressive muscle relaxation. But so all these practices, so the body doesn't have a meditation response, a yoga response, a Tai Chi response. The body has the relaxation response. You can turn the switch on with any one of these practices. So breathing is another very common thing, which I've used in we had a patient who had a heart attack, ER tech. He was shocked 16 times in the ER. Finally, he was brought back to life, had stents put in his heart, the LAD, the left anterior descending artery. As you know, in US, they call it the widowmaker. That's what they call that artery. So he got 2 stents put in there, and fortunately, no muscle damage. Everything came back fine, came back to work. Same ER. So every time there was a heart alert, chest pain patient coming to the ER, he would get a full-blown stress response. Wow. He couldn't work. Yeah. He would check his EKG every day in the ER. Blood pressure every half an hour to 1 hour. Sweating all the time. So finally, I taught him a breathing exercise, which I'll teach now after this. It's called the 4-7-8 breathing technique, which Dr. Andrew Weil taught us in the integrative medicine program. Okay. And so I taught him that. And after that, he started practicing that regularly. And then when he saw a patient in the ER with a stress response, he would connect their heart monitor and tell them to, hey, look at your heart monitor. You're going at 110. I'm going to teach you a breathing exercise. So he would teach them the 4-7-8 breathing. And the heart rate would start coming down 90, 80 like that. And so it worked very, very well. It works for a lot of people. And it takes only 2-3 minutes to do this.
Yes. Would you like to do? Yes, of course. Yes.
So sit straight with, and if you feel self-conscious, anybody, now that they don't have cameras on, it's okay. Otherwise, turn the cameras off. And your hands on your thighs. Let your feet be firmly planted on the floor. We breathe to a count of 4. We hold our breath to a count of 7. And we exhale to a count of 8. And I will keep the count with a small tapping of my feet. So inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Breathe in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Breathe out, 2, 3, 4, 5, 6, 7, 8. Breathe in, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Last time, inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Yeah.
That 8 in exhalation is not easy.
It's not easy.
Yes.
So if it is not easy, what we do is make it a little bit faster. So it doesn't feel, and then slowly we can slow it down. Ideally, once we can bring it down to like each second, so then 4 plus 7, 11 plus 8, 19, you're now taking about 3 breaths a minute. So you really slow down your breathing.
Slow down. Okay. So you double it.
Meaning 4 seconds inhalation, 7 seconds holding, 11. 8 seconds exhalation, 11 plus 8, 19. So 3
Okay.
19s are 57.
Right,
So
right,
7 seconds,
right.
you have only 3 breaths.
Okay, okay. Yeah,
So
yeah.
that's the goal eventually, but the
Right.
ratio is more important.
Okay. The fourth.
Inhalation correlates with the sympathetic activity.
Mhm.
Exhalation correlates with the parasympathetic.
Parasympathetic, which is what we need to trigger. Yeah,
Yeah. And this can be done multiple times a day and
yeah.
help.
In fact, even during instead of counting to 10, this may help to calm one down.
Yeah, definitely. Much more powerful. You kind of,
Yes,
and some people may start feeling sleepy, they start yawning when they do that.
I see. Okay,
Yeah, because,
okay.
if they had not slept properly,
Mm-hmm. Mm-hmm.
at the minute their mind relaxes, immediately, a tendency to sleep comes
Tend to
in.
sleep. Yes, yes. So, Venkat, we've gone almost an hour and a half, and that was amazing. I absolutely enjoyed talking to you, and I've learned so many insights from what you have said as well. Thank you so much for spending your time and spending this hour and a half with us. I'm going to send you the link as well so that you can also share it. It will be on YouTube. And thank you so much again. And I will put your link and your link to your website on the YouTube channel in the comments, so that, as well as in the caption, so that anybody can access it after even after this is over. Yeah. Thank you again, Venkat. Thank you very, very
Thank
much.
you,
I
Sheila. Yeah.
totally enjoyed it.
Oh yeah, thank you. Me too. It's nice to be able to talk to you, and I enjoyed it.
Thank you.
Every
Yeah.
conversation you learn a lot. So
Yes, yes.
thank
Thank
you
you
very
so much. Yes. Thank you so much, Venkat. Bye bye.